Okay, welcome everybody. Thank you for joining us today. My name is Agnes Adekai, and I am Dina. I'm the director of the Circle of Indigenous Empowerment at the Sonoran Center for Excellence in Disabilities here at the University of Arizona College of Medicine. So today's webinar is Finding Balance with Federal, State, and Tribal Benefits with Reverend Nicholas Love. So Reverend Nicholas is a national expert on disability employment and Social Security work incentives with decades of experience in advocacy and human services. He brings a unique and approachable perspective to understanding complex benefit systems. This session will explore how individuals and communities can better navigate federal, state, and tribal benefits while promoting opportunity and inclusion. So before we start, I'm going to make a couple of announcements and some housekeeping. So today's session is being recorded, and all recordings and materials will be available after captioning via email. If you'd like to ask a question, you can type your question in the chat box or use the raise hand button during the presentation, and we'll stop and answer your questions. If you encounter any technical issues, please send a message in the chat to the Sonoran Center, who will be monitoring the chat. And we would also like to read the University of Arizona's land acknowledgement. We respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. So today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Tohono O'odham and the Yaqui, also called Weme. We are committed to diversity and inclusion. The university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So we will start our presentation. So I'll hand it off to Nicholas, who you more than likely you can also do another introduction of yourself if you wish, and you can start your presentation, and I will be monitoring the chat. So remember, if you have any questions, please raise your hand or ask a question in the chat, and we'll stop and answer your questions. And we'll have some more time at the end as well for question and answer. So Nicholas, I hand it off to you.
Thank you. Um, so don't need any long introductions. I'm just Reverend Nicholas Love, and I'm here today to talk about finding balance with federal, state, and tribal benefits. We're going to be focusing on employment. So these are programs that work together so you can work. So we're going to focus on these employment approaches to state, federal, and tribal benefits. We're going to cover some basic Social Security disability information. The deck that you're going to receive has 2026 numbers on it, and Social Security changes those numbers every January 1. So the PowerPoint that you're going to receive is for you to be able to keep and to be able to update as necessary. Take what you need from the slides. I am completely fine with sharing everything. We're going to be covering state vocational rehabilitation as well as tribal vocational rehabilitation. I am going to say though, I cannot address any personal situations. So stories of my son, this or this happened to me, I cannot address, but I will be providing you assistance and resources throughout and at the end of this presentation that will be in the PowerPoint. So let's just do this journey together. And we're going to start with Social Security. So Social Security, or SSA, has two key programs for benefits for people who have disabilities. First is our Supplemental Security Income, or SSI, which is for people who have low income and resources, maybe no work history or very little work history, based on a financial need, so a need for aid. And if you have a need for aid, in Arizona, you get Medicaid, which is what we call access. The other program is Social Security Disability Insurance, SSDI. It is for those who have worked. It's based on work credits, how much people have paid into the system, and you get Medicare. And I'm going to go deeper into each one of these, but not as deep as into the weeds. We're going to very top surface this. So we're going to start with SSI. So SSI, supplemental security income, supplements the income people do not have for basic needs. So they have no or little work history. They have very low income and resources. People have to be living in poverty to be able to receive SSI. So it's based on that financial need to have income, and it's based on the income they do have and their living situation. The maximum someone will ever receive an SSI in 2026 is $994 for an individual, $1,491 for a couple. Because you have a need for financial aid, you have to show that need and you have to keep those resources below $2,000 for an individual or $3,000 for a couple. So I always like to say, supplement an income you don't have for basic needs. So you show a need for aid. If you show a need for aid, you have to have a resource limit to show that need. And if you have a need for aid, you get Medicaid. And that's how I always think about this. One of the key things about SSI is that an individual with no dependents, so somebody who's just themselves, taking care of themselves, they will always, always, always have more money going to work if you're on SSI. Now, if you have dependents, it may affect the dependents, and that is something you can talk to a benefit counselor, which I will be giving you information about. But I can tell you the math is in your favor. If you receive SSI and have no dependents, you can go to work and make more money. And the reason you can do that is because of work incentives. So everybody says Social Security, not everyone. It's too blanket. People say Social Security says, I can't work. Well, Social Security actually says you can work because they made work incentives, which are rules that Social Security created to help support and assist individuals receiving SSDR or SSI or, because you can receive both. It's there to encourage employment without immediate fear of losing those financial supports. So Social Security would not make rules to help you go to work if they didn't think you can go to work. And as Arizona is an employment first state, we believe you can go to work no matter the disability. So these work incentives for SSI are, now that's the first $20 of unearned, so money you get from somewhere, and then the first 65 of earned income. Those are not counted. Anything over that 85 is counted. And what they do is they look at and they call it a 2-for-1 reduction. Well, I don't like 2-for-1 reductions because if you're on SSI, you're still living in poverty. In fact, you're living about 24% below the federal poverty level. And if I say, hey, I'm going to reduce your money, that does not feel well. So I like to say it this way because this is accurate and positive. For every $2 you earn, you get to keep $1 of your SSI check. So you're earning and you're keeping. Eventually, yes, that check will go to zero, but that's okay. By that time, you're making twice as much and you can keep your access. The other work incentive is that impairment related work expense, or IRWE if you hear it. And that's any expenses that the individual living with a disability has that is based on their disability that helps them go to work. So this could be hearing aids, doctor's visits, co-pays, service animals. I mean, all of that, anything that you need to go to work, and you can use it. Excuse me. Excuse me, my apologies. You can use it even when you're not working. So you're going to have hearing aids. You're going to use them when you're not working, right? Glasses, all these things. They're impairment related work expenses due to your disability. Now, if you're blind and on SSI, pretty much every work expense you have will be covered through what's called a blind work expense. Again, these are very top level. If you're an individual under the age of 22 and going to school, regularly attending school, this is student earned income exclusion. So under 22, regularly attending school, can earn up to $2,410 in 2026 without losing one penny of the SSI. There isn't a 2-for-1 reduction until you hit a cap of the annual, which is 9,730. Then they'll do for every $2, you get to keep one. But students can receive $2,410 a month without losing a penny of their benefits or their health care. So that helps a lot of students move forward and parents exhale. There's also work in something called a plan to achieving self-support. This is a past plan. This is a specific plan created to set aside income and resources to achieve a specific work or educational goal. So once you set it aside, it's not a resource limit anymore. So it doesn't affect that $2,000 resource limit. So you could use this to save up for things you need, like assistive technology, mobility issues, wheelchairs, accessible vehicles, education, getting those trainings, work supplies, and what I really like to promote, starting your own business. So you can't start a business if you can't have over $2,000 resources. Make a plan to achieve self-support, a past plan, and you can use that money to build up, to create and start your own business. The goal is always to work off of benefits when you're in a past plan. And this is for people on SSI, but if you have very low SSDI, you may also qualify for a past plan. So very easy, and benefit counselors can help you do this. And there's some other resources I'll share with you as well. Those are rules that help people on SSI go to work and keep their health care and make more money. Now, the other program I said was SSDI, so a whole different program. So we're going to shift over to Social Security Disability Insurance. It is exactly what it says. It's social insurance. SSDI is the social insurance that you use because you've paid into what is the Social Security Trust Fund through your FICA. On your paycheck, your little FICA, that is actually your premium for your social insurance that you're going to use as social insurance when you retire or if you become disabled prior to retirement. It's based on work history, how much has been paid in, and work credits. And it can also be based on a spouse or parent's benefits. When someone receives SSDI, they receive Medicare. And they're either going to receive this cash benefit or not when they go to work, depending on earnings and phase of work. And of course, there's different rules for each phase. It's an all or nothing program. There's never a reduction. So I like to look at this Social Security Disability Insurance. People have paid their fair share into the Social Security Trust Fund. If they paid their fair share, Social Security does not care about your resources. And if they don't care, you get Medicare. That's my little way of remembering all this. They also have work incentives. These are the different phases. The trial work period. It allows people to try work without affecting their benefits, despite how much they earn. There's 9 months in a 5-year rolling window, and it's triggered by earnings over $1,210. So in one of those 9 months, if you earned $1,210, you keep your benefit, use trial work period. If you earn $12,010 that month, which would be awesome, you still only have used one trial work period and you keep that benefit in health care. Then it moves into the extended period eligibility where you either receive cash benefits or not, that on or off, depending on if you're working at substantial gainful activity or SGA. Substantial gainful activity is the monthly earning income that Social Security says you're showing the ability to do significant work. That doesn't mean you're not disabled anymore. It just means you can earn the above the threshold for SGA of $1,690 a month. Or if you're blind, blind is the only disability that has special rules. If it's blind, it's 2,830, simply meaning if after you've done your trial work period, right, you move into what's 36 months, right, 3 years of going on and off benefits. So if you earn over 1,690, your check doesn't come. It's 2 month delay. But then the next month you earn below 1,690, your check will come back. So it goes on and off for those 36 months. My apologies. Impairment rated work expenses also happen in SSDI. So whatever you're paying out of your pocket due to your disability to work reduces what is considered countable income, allowing you to make more money. And SSDI also has wage subsidies and special conditions. So these are when an individual perhaps has a job coach or has a lower productivity that can then bring down what is considered countable income, allowing for benefits. So for both SSI and SSDI, you have the ability to save. Remember that $2,000 for SSI? You can save above it by opening an ABLE account, which is Achieving a Better Life Experience account. And you can save up to $100,000 without affecting the resources limit or your financial need program. So that will not affect your SSI or your SSDI. It will not affect your Medicare or your Medicaid. It will not affect your housing if you have housing assistance, or if you have food stamps, nutritional assistance. None of that will be affected. You must have a disability onset before the age of 46. Now, that's just changed this year. So it used to be 26, but we were able to lobby and be able to get the age of 46 to be able to include people who have onset disabilities later and veterans. So that doesn't mean you're disabled has to be like at 46. Like it could then, for myself, my disability onset was at birth. So my disability onset is prior before the age 46. So I could open an ABLE account. You have $100,000 you can keep in there, but you have a $20,000 annual contribution. So anything over that $20,000 annually, that becomes resources and income. And if someone goes to work, they can add an additional annual contribution of 15,650. So that is a lot of money one can save into a savings account to get past that $2,000. So you can utilize a past plan in SSDI or low SSDI. And try that sentence again. I twisted it. You can have a past plan if you're on SSI or low SSDI. My apologies, I'm having some allergies. Excuse me. So you can open that past plan, or you can also open an ABLE account, which allows you to save this money. You can open this ABLE account in other states, but Arizona has a great ABLE account, but they have different interests in different states. Some have different amounts that you can contribute. And here's something people don't usually think of. If you have resources over $2,000 and you want to apply for SSI, open an ABLE account prior to applying. And now those resources in that ABLE account, that income in that ABLE account are not considered for that $2,000 restriction to allow you then to get on benefits. So you can use it to get on benefits. I'm going to take a little sip. Mm. All right. So those are like SSI, SSDI, and ABLE accounts. It's a lot that I'm throwing at you, but you're going to get resources. So it's okay. Just consider this like the primer, like the appetizer to the deeper information as you go. A lot of concern, though, about work and healthcare. You can work and maintain healthcare in Arizona. Okay, let's go back to the SSI. If SSI, you get Medicaid because you have a need for aid. You get access. That's what Medicaid is in Arizona. Now, for every $2 you earn, you get to keep $1 of your check. Eventually, as you earn more and more, your check will go to zero. Your cash benefits will stop due to work. Yet, 1619B, which is such an exciting name, says, hey, I'm not getting my cash benefits because I'm working at such a high rate of income, yet I get to keep my Medicaid. That is what 1619B says. Don't get a check, get to keep my Medicaid. So you can keep your Medicaid. Medicare for SSDI, because you paid your fair share, Social Security doesn't care, and so you have Medicare, goes on, your Medicare goes on for 8 years or longer when you start working. It can go on indefinitely depending on how much you're earning. Now, if you go above access um, income limit, earned income limit, which is currently over around a little bit above $80,000 a year. So if you make over $80,000 a year, you can buy Medicaid. You can buy Medicaid if you're on SSI or SSDI. You could buy Medicaid access for a monthly premium that is no higher than $35. Now, why would you want to have Medicare and Medicaid? Because it gives you another layer of insurance to support you. Perhaps maybe you want to keep Alltex, Arizona Long-Term Services, Care Services. I forgot the C in there. My apologies. Our acronyms, too many C's. You can buy access free access freedom to work. Also, if you have ever heard, and we're getting away from this because this is not true. If you ever heard somebody tell somebody within the DD system or in Arizona long-term care that they need to work less hours or they're going to lose their Altex or they're going to lose their housing, no, go to work. It doesn't matter how much. You could be working one day for a couple hours a month and still be able to get access freedom to work. You just have to be paying FICA. So you can get Medicaid for no more than $35 a month. You can have $100,000 in your ABLE account, and you can have a PASS plan to help you save for maybe starting your own business. Do you see that's not a fair in Arizona to lose your health care? You also have a right if you get a job, if they have employer sponsored health care, right? So healthcare you're getting from your work. You can have healthcare from your work, Medicare, and Medicaid all at the same time. So if you're an SSDI and you go to work, you can actually triple your healthcare options. And we still have the individual healthcare coverage through healthcare.gov. So that is Social Security going to work and maintaining healthcare. These work incentives, you can get free benefit counseling from the provider in Arizona, which is the Work Incentive Planning and Assistance, or WIPA, to help you make informed choices about work. If you receive an SSI and or SSDI, you're over the age of 14 to full retirement and are actively seeking work or already working, or if you're a youth and a vet, you're always a priority, so you don't need to be actively seeking employment. You can get free counseling by going to the WIPA, and I have the information here. It's managed through Ability 360 through the full state of Arizona. So even if they're not in your particular county, you can still utilize them. They can do virtual, and if you must have somebody come out, they will travel to you. So I'm giving you this information. You also can get this information through the Get Help button on the Arizona DB 101, and we'll talk about that in a little bit. So now let's go. Was there any questions? I'm sorry, before I move forward, was there any questions about what we've covered so far? I'll give you a moment.
I see no questions in the chat.
Thank you so much. Let's move on to state vocational rehab. State vocational rehab is programs that provide service to individuals with disabilities, and they're there to help prepare for work, enter into work, or retain work. right? So they can do evaluations. What kind of interests do you have? What kind of skills do you have? How do we promote those to an employer? What if you need training? So there are training opportunities. They can pay for school if you need a degree for that particular job. So this is something that's really helpful. They can help you search and then help you secure that employment. They can help with arranging, not necessarily arranging, but helping you with transportation, um, the whole plan of how are you going to get to work, keep work, be successful at work, including accommodations. Perhaps you need an accommodation for work. A lot of people are fearful of disclosing their disability. You don't necessarily have to, but if you need something, it's a good thing. And you can get these accommodations. Most accommodations are free or less than $500. So you can go and what kind of accommodations help me? Here's another thought. If you need an accommodation that you have to pay for yourself, that then is something you need to go to work due to your disability, which then becomes an impairment related work expense. So that helps. And then also state vocational rehab can work on self-employment and entrepreneurship. So again, helping create those individual businesses or customized employment, supportive employment. There's a lot of different ways that employment can be uh, provided.
So, Nicholas, we do have a question in the chat.
Yes.
So, the question is a person required to contact Social Security if they work and want to maintain benefits? Or is there an online portal?
Yes, for both. Social Security, you must report your wages to Social Security or any changes in your living situation, particularly if you're on SSI, because you could very much get an overpayment. There's a lot of different ways. I'm going to talk a lot about Arizona DB 101, and next month on the 13th, I will be doing a presentation on that where I will go deeper and I can show you exactly where this information is. But you can go in and the information, how to get into DB 101 is in this PowerPoint. You can go in and there's a whole section how to report. There's even an Apple app for your phone that you can report. You can report through My Social Security. There's a lot of different ways to report. You don't necessarily have to take off of work to go to Social Security, wait all day to tell them you worked. It's a little counterproductive. So yes, you have to report, and yes, there are several different ways to do that reporting. I hope that answered your question. So state vocational rehab, they are throughout the state. They are there to support training, valuations, securing employment, etc. Now, there's also tribal vocational rehab. The tribal vocational rehab provide very similar services that state vocational rehab does, but they do it specifically for only American Indians and Alaska Natives with disabilities to gain that support, right? And it's for Native individuals with disabilities who live um, in or around their tribal areas. They provide, again, those similar employment services with a focus on comprehensive and holistic services. They include, as part of their functional limitation, something the state doesn't do, spiritual functional limitations. So that speaks very much to my personal heart. Tribal vocational programs provide cultural and transition. My tongue does not want to work. My apologies. Cultural and traditional practices and customs as part of the program model and services. So very much looking at the individual tribes' needs, their culture, their traditions, their practices, their ceremonies. They provide native healing practitioner services. So working with talking circles, sweat lodges, ceremonial dance, so much more to get into the truth and the holistic self of Native with disabilities. So they are provided by people within that tribe, the services vary by tribe because they can get additional funding beyond what the state can get by different grants that fit their needs. Now, they can also, and this is important, a lot of people think it's one or the other. It's not. Tribal vocational rehab programs partner with state vocational rehabs to enhance the services. So state and tribal VRs can serve the same person at the same time and share that cost. Tribal VR has less funding, so they can focus on more of the cultural aspects, while the state can maybe focus on more of the overall top level employment. And if you partner between the state and the tribal vocational rehabilitation agencies, it enhances those services. So that collaboration ensures that natives with disabilities receive the fullest scope of services possible. So way more services. You just have to coordinate them. You don't want to have two separate goals from each one. You want to work together. So you may want to work with a state vocational rehab for maybe an educational goal while you're working with the tribal vocational rehab on some holistic approaches to prepare yourself for work. And I don't want to use the word ready because I don't believe in readiness, right? We want to just, what if there's something you need to help you feel more confident, more full, and bring your whole self to work, right? What if you want to be able to just start a job and you need the tribal aspect to talk about how your tribe's going to respond to your self-employment, right? And then the state can be working with getting those additional resources and supplies necessary, right? So they work in collaboration, and it really much serves natives with disabilities to work on those two programs together. Do we have another question? I just saw a little thing
Yes,
pop
we
up.
do. We do have a
Okay.
question from Michael who says, what is the minimum age to receive VR services? The second question, can a high school student apply for VR services?
Yes, and the age is 14. Most people wait till 16 to start the vocational process. You're now 2 years behind. In fact, you're 16 years behind. I really believe employment discussions start as early as your child can comprehend language. Um, Toys that you give children that maybe mimic a job, like even a kitchen or little toolkits or a doctor's little outfit and stuff, little stethoscopes. These are things that are training individuals to believe in themselves and their capacity of employment. So you could start that, toddler, tiny little things and they're chewing on their stethoscope. That's saying, I believe in you and you can, which is where we start with that employment first philosophy in Arizona that everyone, no matter how significant their disability is, can work with the right supports and resources. So 14, though, is the age that you can actually enter into VR services. So I say, as soon as they turn 14, let's start working on that job goal. I hope that helps you, Michael. Any other? Agnes at this time.
No other questions in the chat.
All right. You're going to have to ask me a lot of questions, people, because I'm almost at the end. Uh, and I can go back and we can go deeper. I have no problem with that. I have provided the local tribal vocational rehab phone numbers and websites. Um, like I said, each tribe and region, not each tribe, each region, because we have 22 tribes, but we don't have 22 tribal VRs. So they serve different regions. They're all there for you. And I talked about Arizona Disability Benefits 101, DB 101. Arizona has a website that's Arizona specific information that helps work through those myths and confusion about Social Security. So all those benefit things I threw at you, listed out easy, plain language in Arizona DB 101. They talk about not only Social Security benefits, healthcare, employment, programs that support you in programs for employment, um, independent living, centers, going to school, getting grants for school, starting your own business. They're all in that website. So it's federal, state, disability information, tools and resources. There's estimators. You can go in and say, hey, I want a job at, these are the benefits I get. This is a job I want at this hours, at this wage, and it'll tell you what could happen. What are the chats that questions that just came in, Agnes? Yes, the PowerPoint's going to be provided. No problem. Okay. These are some additional resources. Again, we have Arizona DB 101 up there. We also have the work incentive consultants or your benefit counselors. There's the phone number there. Within Arizona DB 101, I've included programs that support work, which will include connecting to vocational rehab. We do not have the connection to tribal vocational rehab. Creating this PowerPoint, I realized that had been an oversight in Arizona, so I will be reaching back to see if we can start adding some tribal resources. Vocational rehab, state vocational rehab actually pays for Arizona DB 101 and maintains that. We also have Arizona at Work, which allows is focused on people with disabilities, but not just people with disabilities. So it's not just specific. And centers for independence, I really think are important aspects. There are 5 centers for independence um, that serve the state of Arizona, and that allows for people to get some really good information. They have resources and advocacy. So if you don't know where something is, or you need more additional supports, or you can't remember, or you lost a PowerPoint, whatever, contact the Center for Independence, and they will be able to help you with that information and resources. And that is my PowerPoint, which means I have a lot of time left. So I want to see
We
if
do
there's
have
other
some
questions or
questions.
deeper.
Yes, we do have some questions. I
Great.
also put the PowerPoint in the chat so you have automatic access to the PowerPoint and not have to wait for the recording. So
Okay.
the question we have is, are tribal VR services available to tribal members that live in urban locations?
Yes. Urban Native with disabilities can also receive, because as long as you are a member of a tribe, yes, you can. So it doesn't have to just be living on tribal land. It also can be urban natives.
So if a person who lives, well, this is my question. So if a person is in an urban environment, say like Tucson, where
Mhm.
would they go to access VR services? Would it be working with the tribal, which is closest by, or would it be just working with the state if they are a tribal member?
They can do both still. I am embarrassed to say that I cannot remember which tribes are.
So yeah, in Tucson, the closest one would be the Tohono O'odham Nation. But if
Yes,
I am a member of the Navajo Nation, would then Tohono O'odham Nation be willing to work with me, or would I have to work with Navajo?
actually, I think you could argue either way. You could say that I'm in this particular nation, therefore this is where I want to receive my services. Or if you, as Navajo, want to work with someone who understands your particular tribe better, then you could work with the Navajo Nation. So I would just, quite frankly, contact them and see which one's more comfortable for you, where you're located or where your ancestors are, right? So that's what I would do.
Oh, thank you
And
for that.
also can work with the state at the same time. I don't think you can work with both tribals, but I don't know, maybe you can.
Oh, thank
I
you.
never thought of that.
Thank you for clarifying that. We do have another question in the chat
Yes.
from Michael. If a student with a disability wishes to go to college, can VR help with tuition, books, etc.?
Yes. If that college goal is connected to a specific employment outcome. So if they have an employment outcome that requires them to have college education, then yes, vocational rehab can pay for that. They may not pay for the whole thing, which is why in Arizona DB 101, it talks about different like Pell Grants. You got to apply for a Pell Grant if you're going to go through state vocational rehab for education. But then there's also resources for additional supports, how to get scholarships, etc. You can then, if there's like, say, your books aren't being paid for or a lab isn't paid for by vocational, state vocational rehab, or even tribal, um, you can create a past plan for that. You could create a past plan for your whole education as well. But yes, you can, and this is interesting. You can have only with state, I'm not sure with tribal, but with state voc rehab, you can either have an education or an employment goal, right? So you can't have both at the same time. I would see if maybe tribal would help with work and VR state would help with education and see if that works. Or you can be able to utilize the other employment resources on the screen now to be able to help going to work, maybe going to, Arizona at Work or finding another program that supports employment, a provider that does employment, and then have VR do your education. So there's a couple different ways to do it, but yeah, they can pay for school. Vocational rehab has paid for master's degrees if it was related to a specific job.
So this is Agnes. So my question would be then the person would be working with their counselor to come up with a plan where college is part of their plan. And would then that person help them identify and navigate these resources of applying for these different uh, ways to pay for college then?
Um, Try this one, Agnes. They should. Um, there's all different, as in any industry, different commitment and belief structures of what one's job is that may differ from employee to employee. Let's just put it that way. Um, but there are other resources that then can help with that as well. So,
Okay, so what? Because I work with college students here at the University of
mhm,
Arizona, and every year students are required and recommended to fill out the free application for federal student aid, which
mhm,
is the form that you fill out for to see if you're eligible for Pell Grants or other
mhm.
scholarships that universities and colleges use to develop your funding plan for college. And I have not looked and seeing whether there's questions in there regarding services that you receive. So I guess those questions should be on there, right?
Yes, and voc rehab can definitely help with filling out those Pell grants. That is part of a vocational rehab counselor's responsibility. Now, see, this is where some of the tribal vocational rehabilitation can come very handy, is because tribal is working more on a holistic approach. I think that would be a good place to look to help with those additional resources because there are particular grants and scholarships that are directly related towards natives with disabilities. And I think some of the tribal vocational rehab counselor specialists, they have specialists because you don't necessarily have to have a master's degree to do tribal vocational rehab because it's more about a more of a peer-to-peer approach, right? More culturally relevant, more about the whole human being. um, they have other resources and supports that they can do. Where vocational rehab is really focused on just really the employment aspect. Yes, they can work on other aspects to help with resources, but their main focus is vocational, and they don't focus as much as I believe they personally believe they should on the wraparound personal services. But the tribal really gets into the human being.
Thank you for that. And so that brings up another question for me.
Hmm.
Um, this is Agnes, and looking at all these services that are available for people to access, how do people keep track of all these resources of when things need to be submitted, especially now since everything is online? Is there assistance to help people, or is there, um, I'm thinking like I'm old school, I use a planner. So is there a planner or something to help people through this process of keeping track of all this?
There are um, vocational rehab counselors and tribal specialists, vocational rehab specialists. That's part of their job is to help with that support to keep things organized and moving forward as someone works through getting a job. That is what they're supposed to be doing to help. So that could be done um, virtually. It can be done, with phone calls, old school. I wouldn't do mail, but emails. There's a lot of ways to do that. Also, if someone is, because vocational rehab doesn't actually do the job search themselves. What they do is they oversee the whole process and we then refer somebody to a provider to get that particular skill. So if somebody needs help with organization or keeping track of these things, they the provider can help with that. If somebody's looking at their benefits, when am I supposed to submit this? How do I tell, Social Security I'm doing this kind of work and then it changed? That is what a benefit counselor can do for you. So benefit counselors, those free certified work incentive consultants or benefit counselors, they're the same people. There's four of them for the whole state of Arizona. Ooh. I used to manage them, and it's scary that there's only four. So they have priority. So when people are actively looking for work, though, they can work with them and they will go in and say, this is specifically exactly what's going to happen to you. This is how you report. This is when you need to report. And they actually create what's called a work incentive planning, a plan. So they sit there and they tell you, first of the month you do this, and every other month you do this. And if there's a review, this is what you do. So they help with that. Additionally, when we talk about um, Arizona disability benefits in next month on the 13th, there'll be those resources will help people a lot too. And if somebody doesn't have internet, Ability 360 is there to help them with that information.
Thank you for that.
You're welcome.
So we do have several questions that are
Oh,
now
good.
coming in.
Yay.
So Sherry asks, do you have a resource available who can help with understanding SSA's American and Alaska Native special rules? For example, some tribal resources and income can be excluded when considering whether a person can apply for SSI.
So my understanding is for Arizona, tribal income, the per capita for like casinos, and I think there's only two tribes in Arizona who have this. That is not considered income or resource. It's different for Alaska natives. The payment they get every October is considered income. So um, I looked through while doing this research, and I didn't find any other specific um, income or resource rules related to any tribe in Arizona, though, other than the per capita. Unless there's something specific you want to, like, say you have this particular one, I would love to know so I could do more research on it.
So this is Agnes. I think this has come up sometimes, especially when COVID funds have come out for
Right.
tribal communities, because I know some of the tribal communities, had to distribute emergency funds, and there was concerns whether it impacted benefits. But that's as far as I know. But this is a question I think we'll have to continue exploring and providing information on.
Yes. The COVID funds were not considered income. So think of it this way: if it's coming from the federal government, it will not impact federal benefits. Right. So nutritional assistance is not considered a resource necessarily or income. Right. So the federal government isn't, for lack of a better word, penalizing or identifying income If it's their money they're giving you, they're not going to say you can't have this other money from me because I gave you this, right? So if it's federal money, it's not counted. But again, the only one I looked, and I did see the COVID, and the COVID was not considered income because that was emergency one times, sometimes a couple times payments. The per capita for casino money is not considered income or a resource though. And I think only two tribes. It's Pasqua, Yaqui, and I want to say it was a Gila River was the other tribe, but I can't quite remember. Were the only two that were acknowledged within the Social Security that I saw.
Okay, thank you
But I
very
would
much.
love to keep working with you this and try to learn the whole aspect. And I think, we need to be able to really get that information out to people.
Okay. Yes, I agree. So we do have a question from Michael. How can families learn about VR services for their children? Is it up to educators to share the information? And at what age should families receive information to start planning for life after high school?
Again, this is individualized. Most start at 16. They should start receiving at 14. The Work Incentive Opportunity Act says that state vocational rehab must commit 15% of their funding to youth age 14 until they leave school. Um, so they should be receiving it at 14. How do they receive it? Most teachers and educators don't know this information. So I think the best way to receive it is for advocates, providers, service providers, friends, families, everyone in the world, to continue to say, go to Arizona DB 101. I will push this to my last dying breath. I was one of the people who helped bring it to Arizona. Arizona has the most comprehensive, and prior to what the work I am doing now, I worked for the organization that created it and maintains it. It has so much information in there. If if they need additional resources, I would send them to a parent training information center. Um, Encircle Families would be really great. The Arizona DD Planning Council, Michael, who does a lot of great work, are great at sharing this information. I think we just all as a community need to be sharing the information that particularly youth with disabilities, Native youth with disabilities can go to work. We're an employment first state which believes in this, but we don't just believe in it. We are taking action, particularly through the Sonora Center, who is hosting this fabulous website, is creating resources and support to assure we are truly an employment first state, that people with disabilities, no matter how significant, no matter what their age, if they're of working age, have the ability to go to work and the resources and support to do that. So I think it becomes a community thing to make sure people know you can receive these services. And if you don't know, quite frankly, I again would call a Center for Independence and say, I want to know what's available to my kid. Call Parent Training Information Center.
So
That's my
Nicholas, we do
advocate
have,
side to
yeah,
it.
so thank you. So Nicholas, we do have some comments in the chat. Claudia says VR also has providers to assist with a service called supported education to help navigate expectations of further education, organize, etc.
Exactly. They should. And Claudia's right.
And then Sherry says, a quote, land held in trust or restricted status is generally not counted as resource when
That is true
determining
as well.
SSI. Okay.
Thank you.
And then Deborah says, I'm a rehab tech with Voc Rehab in Cottonwood. The school's SPED department should have information VR for students. I put together packets every year that SPED teachers should be sharing with their students.
And this is where we get specific VR consultants or techs who do fabulous work. Thank you very much for doing that, putting together those packets and sharing it.
And then Claudia says, I'm also VR's statewide developmental disability specialist and always available to assist. And
Thank
their
you.
email is in the chat.
See,
CM.
this is what we're talking about. There are
Uh-huh.
certain counselors that are just very good. Thank you. And I know Claudia is one of them.
Okay. And then I put in chat the link to next month's webinar on employment support through disability benefits 101. So we have that in the chat and a link to register. So we'll be going through Disability 101. And so again, Nicholas will be presenting. So are there any other additional questions before we conclude today's webinar? And we would also love your feedback. So we do have an evaluation form, a survey for you to click on and provide us feedback. Your feedback is valuable because we use that to for our reports to our funders who help us with this particular webinar series, the Arizona Developmental uh, Disabilities Planning Council. So funding is possible through funding support from the council. So information we present goes back to our funder, but also to help us plan future webinars as well. So we appreciate um, your responses. And then, of course, Nicholas has his contact information and a QR code to use your phone on. So again, thank you very much. Any last words, Nicholas?
Um, I really appreciate this opportunity. I hope it provided some different information, provided you some different concepts. And what I really, really just want to push is again, this is our community. All of this doesn't matter which tribe you're part of, it doesn't matter if you're urban or rural. We are all on this planet together, and we all need to support each other and bring everyone's gifts forward. Everyone was born with a gift, and I believe they can utilize those gifts to be able to create the life they want through employment. No one should live in poverty due to a disability. So let's all work together to share this information and to support our whole human race. And with that, I say namaste, which means I honor the spirit within you. Thank
Thank
you.
you very much, Nicholas. I can. So thank you for attending our webinar, and this concludes our session.